Hello and welcome to Healthcare IT Today, where we explore the latest trends and interesting stories from the world of health IT. I'm Colin Hung, and I'm about to sit down with David Sides, CEO of NextGen Healthcare, and Dr. Bob Murry, Chief Medical Officer, also from NextGen Healthcare. I'm excited to sit down with both of these gentlemen because I want to get their take on AI in healthcare. I also want to get their impressions of how the rollout of their Ambient Assist product has gone over the last few months. Ambient Assist is NextGen's version of the ambient clinical voice solutions that we've seen rolling out everywhere in the EHR market. I hope you enjoy this interview. Gentlemen, welcome to the program.
Thanks for having us today.
Absolutely, thank you.
I'm excited for this conversation. I just saw you guys on stage talking about all your new products, and we're going to dive into that. But have to start by asking you this question. It is by far the hottest topic of the last year, and that, of course, is artificial intelligence, AI. In your opinion, what's hype and what's not hype?
I think some of the hype is around doing simple things with the technology, like responding to patients' requests or something, patients' emails. Like that's not really that interesting, right? You could have done that with a template. To respond to what about my labs? Well, what does this mean? That could have been a template. You don't need ChatGPT for that, for instance. But where I think there's actually real utility is things like what we're doing with ambient listening, where you can document an encounter, remove the EMR from the conversation, and have a patient-provider discussion, eye to eye, face to face. And as you talk, it writes things down. We have our setup where it doesn't save anything, so you don't have to worry about privacy or anything like that. We're not trying to further tune the model because the model's already tuned. And at the end of that discussion, it creates a note. And so then you have a documentation that you can use slight edits maybe and save it. So you essentially saved 2 to 5 minutes for a provider to either type, which is the worst, right? Because then I'm not looking at you, I'm looking at my computer while I type, or dictate afterwards. Or if I'm really back to back, I'm dictating at the end of the day what did we talk about? I saw 20 people, the details are probably there, but not as clear as they would be. Or we make a note, edit it, save it, and you're done. So I think that's, really a revolutionary way to change how people are interacting with the patient and how they're interacting with the consumer, with the EMR, and it kind of fades the EMR to the background where, we'd like it to be.
No, I completely agree. I mean, Ambient is definitely ready for prime time. It is ready to be a thing that can help the doctors. I think the hype area starts to get into, I'd be a little wary of things that are smart something or other, intelligent something or other, because these AI systems, despite the name, are not intelligent, right? They can be very useful. They can be great assistants. But that's really where they are now. And so I think Ambient is one big area for that. I think there are, clinical decision support tools. Again, support, not deciding tools that are there, and other areas where AI is going to help people be smarter, be faster, get access to more information, summarized. But they're not going to be making smart decisions. And I think if you think they are, that's where the hype is.
Yeah, adding on to that, I think the hype is like chatbots to patients. That is worrisome.
I agree with that.
To me, right? Because let's say you're chatting with someone who has 5 conditions, and their question is, how do my drugs interact with each other? Like, you need to actually talk to your doctor on those type of things, right? So we're trying to keep the technology where it's useful and not expand it where it's, kind of artificial general intelligence, which doesn't exist, where, I think this thing actually has a mind and can think as well as a person, let alone think as well as a doctor. That is a poor application of the technology in our view.
Yeah, what I'm hearing both of you say is that AI right now sounds to be more of a co-pilot than the pilot. You definitely don't want this thing, the technology, to be in the driver's seat or the pilot seat right away. It's more of an add-on, as you said, to help with maybe some workflow, help reduce some tasks that maybe are repetitive, but definitely not anything diagnosis or anything dealing directly with care, it sounds like.
Yeah, exactly. Agreed.
So on that note, there's been a lot of talk about putting some guardrails up on AI. Do you think that's necessary, or is there something maybe the industry can do to make sure that we're applying AI in the right way?
I mean, I think it starts with, if you're treating the AI as a tool or as an assistant, I think a lot of those guardrails are automatic. I think the one area we definitely have to be aware of, right, is that, especially the large language models, maybe the easiest to describe. So those are trained in items from the real world, right? But the real world is full of bias, right? It's full of inequity. And so those models are trained on that. And then if you turn around and ask the model, well, what should the world do or look like? It's going to reply with bias and inequity. And so that is going to have to be of particular, thoughtful design in the applications where that sort of bias could get, echoed by the AI. I think there's ways around that, but that's where you're going to have to be real careful.
Again, I think our guardrails are, to your point, co-pilot, not pilot. If you keep out of pilot, then I think you're in a good place. If you get to pilot and you get the bias, you're just reinforcing it, and probably almost more than maybe even exists in the real world. So we don't want to go that direction. We're trying to say, how can you use this tool to automate workflows, to do things like kind of auto dictation and then summarization appropriately. How can we, and we can talk about this too, we're thinking about it in many applications, but we think one size doesn't fit all as far as the AI tools that you use. So, it could be that AWS has the best model for this application. You have a great model from Google here. You have a model from someone else, Microsoft here, OpenAI here. We're making these plug and play because I don't think there'll be one all singing, all dancing model. There'll be models that are appropriate for the problem you're trying to solve. And even in our ambient listening, we're putting multiple models together to get to the result. That's part of the innovation.
And I think, the best guardrail, right? This reminds me of a story from, 15, 20 years ago when we were starting to implement EHRs. I'd go out to, offices and I'd write down on a Post-it note, right? This computer has no brain, use your own. And it still applies. The computer's a lot smarter than it used to be, but it still doesn't have a brain. You really need to use your own.
I think you need to put that back on a sticker so that people can put
Correct.
it on their tablets now that they're going to be using.
ChatGPT-4 has no brain.
Exactly. I do want to just focus in on something you said there, Dr. Murry. The fact that you're just acknowledging that there's bias is sort of my first step in my mind, is to say, look, these algorithms are not infallible. They are trained on data, and the data is only as good as what you fed it.
Sure.
And if you've only fed it people who are over 60, living in a certain region of the US, well, inherently there's some bias to that. We all know that. And when, as you both said, if you try to base decisions solely on what that machine is telling you, that's where it can lead you into trouble. No different than if you just read one study and said, that's now the basis of my care.
Right.
You probably wouldn't want that. And yet we sometimes ascribe the same kind of intelligence to, or we do the same thing with AI.
Because the language of the answer looks so professional. It looks so authoritative. You think, oh, wow, it's really smart. No, it's just, better at describing the same, sort of, unsmartness.
Well, let's get a little bit more narrow. On the stage, you both re-announced or kind of reaffirmed the new product that you have, Ambient Assist, which is the ambient clinical voice application of AI in the NextGen platform. Tell me more about that, and what has the response been so far to it?
The response has been great from clients, because I think they see that this actually will save them time, right? And they can decide what they do with that time. Do I go home earlier, or I don't work when I'm at home, right? So I'm not logging back in when I get home into the EMR. Do I see more patients? What do I do with this tool now that I have it? And I think they also see that we're going to save them time with this, but it's just the first application, right? So we're going to take it further from here. It'll do documentation. The next thing we've been working on is also starting to pre-fill out orders or order sets, and then even looking at the entire note to get some potential billing codes. So our tagline is really, the new user interface is no user interface. So instead of a computer between you and the patient, you've just got your phone or your iPad or whatever you're using, recording. Not recording, listening. We don't record anything, so it's one of the ways we try to keep everything private, even though we encrypt, but we're not saving any of that conversation until the note is edited by the physician and saved. But it's like listening, you get that. It says, here's the orders I heard you say, here's the billing codes that might be applicable, edit what you need, sign, and that's the entire process. So instead of saving clicks, you're just there. There's only one click. So that it's just revolutionary, kind of like the same way people have rethought things like even starting your car, right? It used to be you put your key in, you put your foot on the brake, you turned it. If you've used, some modern Teslas or something, you just get in and you push the accelerator. Like it knows you're going to back up, so it puts it in reverse for you. That's not that many steps, but it's taking it out, and we're just taking all those steps out rather than just trying to improve the old UI to be slightly faster. Just eliminate the UI.
Yeah, I think two keys there. I think the particular partner that we've chosen for the large language model seems to be the best. That's the feedback we're hearing from our clients that have seen demos of other products. Again, we're going to be mercenary about it. We're going to use that one as long as it's the best, and then we might swap it out. But the other absolute key thing is, with Ambient Assist, it's just it's natively embedded in the provider's workflow, right? We already had a provider mobile app. Thousands of providers were already using it to do their documentation or do lots of different things in the EHR, and we plugged it into that. I think that some of the solutions that kind of are trying to deliver a completed note at the end of it, that's more problematic because it puts so much more pressure on that note being perfect. And I've been using Ambient Assist for a couple months as pre-release version, and it's a terrific start of the note, right? Hey, for some encounters, it is the whole note, right? But I don't approach it thinking that's going to be the case. I approach it thinking, okay, well, it's done all the simple stuff. What is the actual medical, complexity or nuance that I might need to add? Just tap, use my voice, add that, sentence or two to whichever section of the encounter is most relevant, and then send the whole thing off. It's a combination, but we can do that because it's already part of an established workflow.
As I walk around here at the user conference, there are some signs with some of the reactions of your customers to Ambient Assist. They're quite glowing. There's a lot of talk on there about joy and about getting time back and how this is going to make a huge difference. Has the response been to your expectations in terms of those that have been using it? I mean,
yeah, I think beyond expectations, right? I mean, I want to temper that, right? Because it's mind blowing, and like the immediate applicability and the immediate usefulness in terms of saving you 1, 2, 3, 5 minutes an encounter. Is so present, but I don't want people to think that, again, it's going to do everything, right? Because if you approach it with that and it misses something that you wished it did, or it messes up in this way or whatever, you're like, oh, this thing is useless. And I think that remember, the technology is only going to get better, so its kind of accuracy and utility is going to increase. The key is to, just like other things, a large language model, whatever, begin to incorporate it into your work, right? Use it for what it's good for. It will get better and better at more and more things. And so I think that that's going to be the key, is to go ahead and start it. And people are seeing that. The reaction has been, yeah, we definitely want this. Where can we install it? How fast?
Yeah, one of the things that differentiates us compared to some others is once you click make a note, you get a note in 20 seconds. Yeah, so there's no lag of some of the competitors out there. I think they're using humans on the other side. So it's like you get the note back 2 and 3 hours later, which is not as helpful.
Not at all.
And not, they're not applying the technology correctly, as we are with our partners who are doing a great job. And then we're also trying to make it price competitive, right? So we think that this, especially since we serve a third of the FQHCs in the federally qualified health centers in the US who serve the underprivileged, which about 10% of the US receives their care from these facilities. We're like, we know that this has to be super relevant so they can hire more therapists, more physicians, instead of spending money on technology, and it needs an ROI. The good news is the ROI is immediate, right? You can see one more patient and pay for the technology in a day, and you're good. So that part's really nice, and then people are deciding how do they apply it, but it will only improve from here as we automate more parts of the workflow.
Dr. Murry, let me ask you this question. If there was a clinician out there who's maybe a little bit hesitant about trying this technology, what would you say to them to maybe encourage them to give it a go?
Yeah, it's a great question. I mean, I would ask them, like, what are you afraid of, right? It's not going to take your job as a doctor. I think most of the fears or hesitancy a little misfounded. I think some people have some privacy concerns. And again, the way that we're implementing it, nothing is stored. We're not using this to retrain the model or anything. Like, those kinds of concerns are not really well founded. And I think then the key then is just try it, but try it with the right thing. Like, it's going to do amazing things, but the things that it does are simple, right? You are still going to need to add on, your thoughts or the nuances of, the medical decision or this part of the history. But you can have those very quickly, and then you're like, wait a second, okay, I could really get to this, but you really have to try it, and we've set it up that way so that people can actually, try it for free, just to see if it's useful. And my guess is that many people, many different practice styles, different kinds of encounters, different specialties, are all immediately going to find, wait a second, yeah, I could use this.
When we get together a year from now, what do you hope people will say about NextGen and AI next year when we gather back for the user conference? What will they have done or used? Or
I think so. We talked to our user group last year and told them we'd be doing Ambient in a year, and we didn't really have it worked out. So you could tell that the technology was coming quickly enough. We had the right hooks in the application to integrate multiple large language models, and we started working on it, and the team came up with ways and then improved ways, and we've surveyed the entire market and think we have the best solution out there. We're looking at it really pragmatically, though, on, okay, now we've worked on the visit. What can we work on pre-visit? What can we work on post-visit? To really continue to improve the provider experience and reduce provider burnout that's so prevalent. And so in the pre-visit, that's a place where actually ChatGPT is pretty reasonable. So you can tokenize things, so there's actually no data sent to them. It's just a bunch of gibberish that goes to ChatGPT, but it summarizes the gibberish really well, and then you turn it back into, Dr. Bob has cardiology, whatever. That looks pretty promising. The problem is it's a lot of processing power, so it's expensive to run. But for a complex patient you haven't seen for a year, it may be better to be able to say, tell me the most relevant facts and summarize what's happened to this patient with, this year, over multiple hospital visits and all those CCDAs that would be really cumbersome to get through. It's a good tool like that, or ask it a question, how's their diabetes been controlled? And it may give you, graph backs and things like that. So we'll see, that could be promising. And on the post-visit, we've looked at things like, maybe you take that same note and you summarize it in a patient-specific way, automatically send them a message back that says, hey, here's what happened from the visit, here's what you're supposed to do. That can be good, but not really answering their questions, right? I think that's starting to get into the pilot space too much.
Yeah.
But summarizing that note back in a consumer-readable 6th grade level, I think could have utility. We'll see. We'll run experiments with it.
I think the other big thing that's going to come within the next year is the use of the voice, transcription, not just for the note, but you can run it through multiple different models, right? You can run that same conversation through a model that's designed to pull out the orders, present them to the provider and say, hey, did you order this medication? You want it sent to this pharmacy and you ordered these 2 labs for next week? Is that what you want? Yes, boom. And then it, interacts with the EHR and does those things. But I would love it next year. I think people are going to come, and first of all, if they're just users, like, this is great. I think that's going to happen. I think they're going to come with a million kind of tips and tricks that they're wanting to share with each other. And I also think they're going to come with, lots of really good ideas for what else it could do. And that's, I think, when we succeeded, when they start to say, hey, it could do this, it could do that, like that, because then you've moved from, I'm not so sure about this in my SOAP note, to, I want to use this more. And I actually do think that's what we'll see next year.
Totally embedded in our workflow.
Correct.
And we're already seeing some of that. Like, people are like, can you run my macros?
Yeah.
To do this, or this specific, piece that I need for this, insurance company, et cetera. And it's like, okay, it's not the original thought, but it's further reducing the workload. And then they're spending time on, thinking about the true medical problems and working on that, rather than all this kind of almost mindless documentation sometimes.
Dr. Murry, I want to give you a chance very quickly to tell our audience about something you're very passionate about, and that's, of course, the health equity street medicine initiatives that you have. If you don't mind giving us a quick overview of what you're doing there.
Sure. NextGen has lots of, health equity initiatives, but one of the things that we are very proud of is that a lot of our tools for clinicians are fully mobile. And so that helps in all kinds of ways. One of the biggest equity issues, right, is access. So, as David mentioned, we serve many FQHCs. They have all kinds of programs. They have school-based programs and community-based programs. but a lot of them actually go and serve unhoused people, homeless folks. And so our tools enable them to do that, but still in constant communication both with the people at the practice and with the electronic medical record at the practice, so they can provide wonderful care, but out on the streets. And so we have some presentations here, and we've given many in the past, and we're very, very proud of our providers that are able to extend that reach in that way.
Final question for both of you. It's been an adventurous year for NextGen. You've been in the news a lot. What message do you want to make sure your customers hear from both of you?
Yeah, I mean, that we're really investing in the technology and moving things forward in an innovative way, and also not to let our competitors define us. So we went private. We've been public for 40 years. All of our competitors are private, and somehow us going private, they're like, "Oh, this is a bad thing." And it's like, well, you guys have been private your whole life, I mean, how's that any different? So, I think, it's hard to get through the message sometimes. It's like, look, our technology is advancing really rapidly. Don't listen to the noise of competitors who are already in the exact same spot we are from a ownership perspective. It doesn't matter.
Yeah, and from my standpoint, I think NextGen is the best system on the market. If you don't want to get bought by that big health system and you want to have your own practice, be it big or be it small, you can use our system out of the box. But you can also really change our system to be able to practice medicine the way you want to practice medicine, but also, make the finances work so that you can fulfill that mission in the case of an FQHC, or in the case of a new business model for medicine, or just, practicing with a group of people that you really like in a way that you had always wanted to do.
Yeah, I would summarize that. That's great. We want the tool to fit you, not you to fit the tool. And too many of the EMRs out there, you have to fit the tool. So your practice has to fit the tool. We're not only trying to, the tools should fit you, but even get the tool out of the way and have the user interface be no user interface. So it's totally working with how you practice. It adapts to you, not the other way around.
Gentlemen, loved all the information you shared with us today. Thank you so much for taking time out of your day to be on our program.
Thank you. We really appreciate it.
Thanks for having us.
Hey, I want to thank David and Dr. Murry for coming on camera with me and for sitting down and giving us that behind the scenes look at how things are going with their Ambient Assist module. It's very exciting to hear that the customer reaction has been so positive. I also really enjoyed Dr. Murray's take on street medicine and his initiatives that he is personally championing around health equity. And hey, if you enjoyed this interview as much as I did, please like and subscribe. Also, head on over to healthcareitttoday.com where you can find more great content like this. I'm Colin Hung. Thanks for being here, and I'll catch you on the next video.